Hello, everyone. It's Miss Hardy recording for Foundations of Health Science. It is Tuesday, January 26th, and we are starting the history of medicine. So we break this unit down into three mini units. First, we start with a timeline. Then we move on to the people who contributed to the history of medicine. And finally, we finish off with what's currently happening in medicine. So first and foremost, you're going to need to create a timeline. I'm going to help you with that. I'm going to post my timeline for you tomorrow, but we'll start with the pieces today. So as we scroll through this, unlocking the history of medicine, everything that's happened in the past has contributed to how we practice medicine today. It is certainly a trial and error. Some things that we used to do in the past still work today, and some things that we did in the past, we look back on today and think, what were we thinking as medical professionals? But remember, back in the day, and I'm talking really far back in the day, we didn't know what we do now. So starting with the primitive times. So primitive is cavemen, guys. We're talking way, way back there. You are not required to know the years of the primitive times for this or the Egyptian times or anything like that, but you will need to know these in order because we build from one time in history to the next. So in the primitive times, the cavemen times, people believed that illness and diseases were a punishment from the gods. So if you did something bad to someone, you would be punished by getting sick. The first physicians were not real doctors, they were witch doctors. So they believed in doing ceremonies, talking to the clouds, things like that, based in very much so old family traditions to treat your illness. But remember, you most likely got sick back then because they thought you were being punished for doing something wrong. The primitive times we used herbs and plants for medicine. So some of this is still true, and some of this was certainly the right thing to do, but they may not have known why. So, an example here is foxglove plant leaves were chewed to strengthen and slow the heart. But of course, now instead of chewing leaves and herbs and plants, we give medicine by pills, IVs, or injections. So, they did learn that things that grow in nature can help us physically. Trepanation was also performed in the primitive times. So, what you see here, that big hole in the skull, that's exactly what it was. Trepanation was one of the very first surgeries. And it was done because they thought in the primitive times, since the gods made you sick because you were a bad person, we would cut into your skull or drill a big hole into your skull like this to release the demons that were in you for treating people poorly. Obviously, some possible complications of this would be death, they go too far, mental retardation because they went too far and they damaged your brain. Intellectual disability is another, the more appropriate way of saying mental retardation, obviously, in our day and age. Also, infection, there was no way to keep this area clean. Infection, it would also lead to possible complications such as stroke, seizure, and obviously lifelong disorders. This is our next step in the timeline, Egyptians. The Egyptians were the first ones to keep accurate health records. They had this really cool paper called papyrus, and they would write down what they did with each patient, with each sickness, so that they could maybe refer back to it later. So, this was a step in the right direction in what we know now as medical records. Physicians were priests. So if you went to church and temples where you worshiped whoever you worshiped at that time, then you would also be visiting your physician. So again, physicians were priests. These were your prized people, the most important people in your area. So where you went to pray is also where you went to get treatment. The Egyptians also started to embalm bodies. We know mummies, they used embalming fluid to keep those bodies from rotting and decaying. And we learned a lot about anatomy and physiology and diseases during that time. Anatomy, of course, being all the parts and pieces that make up the body. This was done by special priests, so you had to be a special type of priest to perform embalming because messing with dead bodies was a very sacred ceremony back in the Egyptian times. So, someone who was treating you for a sickness while you were alive is not the same person who was studying your body once you had passed away. And of course, we talked about mummies like you see here in this picture. It was created using gauze to wrap the bodies. It's very similar to the gauze that we use today, multiple layers. If you ever want to see gauze, I have a lot in my room if you're a face-to-face learner, or of course I can show you virtually. And we use strong antiseptics, antiseptic being a special type of fluid to keep the body from decaying, and that was in that embalming process. Egyptians also use leeches. Guys, this is a really important slide because leeches are really cool and they actually are still used to this day to help with certain diseases. Leeches eat blood, okay, so they drain human blood. So that process is called bloodletting. Leeches have a couple of special characteristics about them. First and foremost, it doesn't hurt when leeches attach onto you and start to let your blood drain because they have a natural anesthetic or numbing agent in their saliva. Their saliva also has a blood thinner in it. A blood thinner makes your blood thinner because we know blood can be kind of thick when it's oozing. A vasodilator, which basically means that it makes your veins and arteries and the blood vessels dilate, just like when you go to the doctor, they get bigger, so the blood flows more freely. And they also have a special agent in their saliva that prevents bacteria from infecting the wound. So they can clean your blood in a way by taking it out or letting the blood flow. And this was a really important step in the right direction because, again, the FDA has recently, FDA being the Food and Drug Administration, or the people who are in charge of all the things we're allowed to give our patients, have recently reapproved this as a medical treatment. So there's definitely some fact behind this treatment. Moving on in our timeline, we have the ancient Chinese. The ancient Chinese did not believe in dissecting bodies, so we did not learn a lot about anatomy and physiology from the Chinese during this time period. They believe that you had to treat both the body and the spirit, and the spirit can be related to your soul, who you are as a person. But what the Chinese did do is record a lot of medications, what they used and what they did, and how they created the medicines based on herbs and plants and things like that. What you see here, this picture is what is an example of acupuncture. So acupuncture is using small needles in very particular sites on the body to relieve pressure, to relieve pain, and to treat a variety of disorders. So that's what you see here. If you ever want to see more pictures, you can Google acupuncture and it'll pull up tons of pictures with different places in the body. Greeks is our next one. So Greeks made a lot of observations about the human body. They studied how people got sick and they made observations that led to what we practice now as modern medicine. They were the first ones, guys, and this is really important. The Greeks were the first ones that believed that illness was a result of natural causes. So you had a germ or you had a cold, not that you had done someone wrong and the gods were punishing you. So this was a huge leap in modern medicine, okay? Because we no longer believe that because you were a bad person, you got sick. It was because of something naturally going on, germs, things like that. The Greeks also used different therapies such as massage, art, and herbal treatments to treat different disorders. They discovered that the better your diet was, the better you ate, and the cleaner you were, it could prevent diseases. Up until this point, people would routinely use the bathroom in a pot or some sort of structure in their home and they would dump it in the street because we didn't know that that level of cleanliness, such as not sleeping where you poop at, would help you stay healthy. They also realized that diet played a big role in this too. So remember, the Greeks would drink a lot of wine and they would eat a lot of meat and cheeses and things like that. And they started to realize that if you ate better, you might feel better. Moving on to the Romans. So the Romans come after the Greeks. So remember, we're building our timeline here, and they established the first public health and sanitation system. So they were the first ones to realize we really need to make this kind of like a everybody does this kind of thing. Everybody needs to be careful where they're dumping their poop, where they're dumping their pee. So we're talking about our sewer systems here and our aqueducts. And aqueducts kind of control water and it separates your clean water, what you're going to use for consumption, from your dirty water or what you might have peed and pooped in earlier. They treated disease with diet, exercise, and medication. So we really are on the right path here. We're starting to realize that disease is natural causes and you could either prevent it and or treat it by watching what you eat, exercising, being healthy, and certain medications. The Romans also were the very first ones to create what we now know as a hospital. So soldiers would go off to war and when they were injured, they would come back to their city and they didn't have hospitals or places for the sick in these days. So, what they would do is they would stay in their doctors' homes. And that is what we now know as a hospital. The doctors' houses would eventually become where multiple soldiers came to seek treatment. And that became what we now know as a hospital. And I can almost guarantee you this is on your test. So, make sure you know it. The Romans also believed that the body was regulated by four humors. And if humor is confusing you, we're not talking about the comedians here. We're talking about fluids. So the four fluids that the Romans believed helped you stay balanced would be your blood, phlegm, which is another fancy word for snot, black bile, and yellow bile. And you do need to know those. They believed that if you regulated these four humors or liquids, you would stay healthy. Then we get to the Dark Ages. So the Dark Ages, think about that light bulb that pops up above your head when you have an idea. In the Dark Ages, that didn't happen. Study of medicine was completely prohibited. Prohibited means not allowed. You were not allowed to study medicine during this time. The emphasis was on saving the soul. So you needed to make sure that you were a good person, that you completed your prayers every day, that you prayed to the Lord, and whatever happens, happens. At this point, they no longer treated you for sickness and illness. They would basically pray for you and hope that God would save you and save your soul. We move to the Middle Ages here. The Middle Ages, it's very important that you know this here. The bubonic plague killed 75% of the population in Europe and Asia. So we call this the Middle Ages because this is where things start to change, okay? Medical universities, what do you do at universities? You study, were created. So people started to study medicine more, and there was a renewed interest in the medical practices of the Greek and Romans. Because remember, the Greek and Romans were the only ones who had started to really figure things out up until this point in our timeline. The Middle Ages, we also have where Arab physicians started to use chemistry to advance pharmacology. If you see pharmacology here, the first part of this word is pharma, which means pharmaceuticals or medication, and ology, which is the study. So this is the study of medications. Arabs also began requiring physicians to pass exams and obtain licenses. So this meant that not any Joe Schmo off the street could practice medicine. And just because you worked in a church and you were a priest did not make you a physician. You had to pass special tests. Moving forward in our timeline, we get to the Renaissance. So the Renaissance is where we really started to dissect bodies to understand how the body works. Again, when you study anatomy and physiology, you first have to learn the pieces and then you learn how they work together. So learning the pieces is anatomy, learning how they work together is physiology. And what's really important that happened during the Renaissance is the invention of the printing press. The printing press allowed for people to make multiple copies of books. So before we had the printing press, you only knew what was happening in your area. So if I was a doctor in Greenville, I only knew what was happening in medicine in Greenville. There was no way for me to share my information with someone that lived in Charlotte, unless for some reason we came in contact with one another or there was passing through word of mouth. And we all know that if a rumor starts, the rumor is completely different by the time it gets back to the person. So remember playing telephone in middle school? So the printing press allowed for accurate medical knowledge to be shared from person to person because we could make a book. Okay. And the first anatomy book, remember, anatomy is the study of the parts, was created by Andreas Vesalius and it was published and shared. So it allowed for medical knowledge to be shared. During the 16th, 17th, and 18th centuries, we group these together because a lot of things happened here. During this time, the invention of the microscope allowed for doctors to see disease-causing organisms, or what we now know as microorganisms or germs. Apothecaries, which is where you used to go to get your medicines, became pharmacies, and they were more regulated and obviously more accurate. Edward Jenner developed the first vaccine. So not only do you have to know this in the timeline, but you're going to have to know who he is and what he did. He developed the first vaccine to prevent the spread of smallpox in 1796. Guys, think about that time. We're in 2021. So the first vaccine happened so long ago. We obviously made leaps and bounds in medical discoveries. In the 19th century, formal training for nurses began by Florence Nightingale. We started to practice infection control. When we control something, it means we try to limit something. We are trying to exercise our power over it. So, in order to fight infections, we started doing things that made sense, like washing our hands, making sure that if someone was sick, they isolate themselves. All of those are examples of infection control. In the 20th century, we learned more about the blood groups in the body, and we learned about how our white blood cells or our leukocytes protect us from disease. In order to fight disease, we had to learn how we protect ourselves from it. In the 20th century, all of these things happened. So insulin was created to treat diabetes. We realized that antibiotics that could fight infections was caused by bacteria. So antibiotics don't work against viruses, but they work against bacteria. And if you take biomedical technology, which is the next class, you learn a lot about that. Vaccines were created and perfected to prevent people from getting diseases that were caused by viruses, such as the coronavirus. There's a vaccine for it now. And because of what we were doing in the 17th, 18th, 19th centuries, 20th centuries, we can now create those vaccines a lot faster and a lot more accurately. We also developed all of these new machines that you see here, the kidney dialysis machine, heart lung machine, CAT scans, all of those diagnostic. Remember when we diagnose somebody, we figure out what's wrong with them. So a lot of diagnostic stuff here. We also perfected and created some more surgical and diagnostic techniques, such as organ transplants. Before, if your kidneys gave out, they gave out, and I'm sorry, that was the end of your life. But now we could give you a new one. We could reattach limbs that were lost in tragic accidents. We could create test tube babies, so we could create embryos outside of the womb. Amniocentesis, which is a surgical puncture into the amniotic sac of a baby to diagnose different genetic abnormalities or issues in the womb. We implanted the first artificial heart. How cool is that? We also developed healthcare plans. So before we developed healthcare plans, we didn't know how people could pay for all of these medical things. Because remember, the more technology is involved and the more we know, the more expensive things are. So it's really important that we open up healthcare to having everyone have access to all of these medical advances. So Medicare and Medicaid mark the entry of the federal government because Medicare and Medicaid are paid by federal taxes. So that's the federal government entering healthcare. HMOs, which is health maintenance organizations, provide an alternative to private insurance. So Ms. Hardy is employed by Pitt County Schools, so I have private insurance with Blue Cross and Blue Shield. We're going to dive into that a little bit more when we get to the next section, so don't worry about that. And of course, hospice was organized. And hospice is an option for people who are close to death. Usually it's someone who has 6 months or less to live, and it helps the patient and the family transition from life to death a little bit more smooth, so they can help you figure out what you want, help you figure out what you want at your funeral, help you organize your finances and things like that, and of course help your family with their grief. And that is it for this first section on healthcare history. So as we scroll back up, you're going to see your assignment posted underneath this. I want you to start with the basics of your timeline. So you're going to go through and just list the time periods and at least 2 facts from each time period to have as your basis for your timeline. Okay. Let me know if you have any questions. I'll be here to help you. Thanks, guys.